And welcome back to my YouTube channel. So today is the part 7 of the simplest road to crack GPAT series, and today's topic is cosmeceuticals and nutraceuticals. So not much frequently the questions have been asked from these topics, but sometimes seldom 1 to 2 questions could pop up in the examinations. So we need to be well versed with few of the topics. So the number one priority is the difference between vanishing cream and the cold cream. So cold cream and vanishing cream are basically day and night creams. One is a O by W emulsion while the other one is a W by O emulsion. Vanishing cream, from the name itself, once you apply on the skin, it will vanish. While cold cream, it will leave a thin emollient layer, a filmy type layer on your skin. The next one is a sunscreen. Sunscreen is basically used to protect your skin from harmful UVA and UVB rays. So you need to know the SPF factor 30-50 and the Fitzpatrick classification of the skin. Like if it's skin type 1, 2, 3, 4, 5, which one burns the most, which one gets tans the most. And you need to know the formula to calculate the sun protection factor, which is minimum erythema dose of the protected skin upon minimum erythema dose of the unprotected skin. Next up we have is list of excipients and functions. So various excipients have been incorporated in a formulation when we speak about cosmetics. So we can say emollient, emulsifier, suspending agent. Then you have certain agents that are like when we speak about shampoos, when we speak about dyes, we have colorants, we have conditioners. So many different excipients have been used. So we have borax, we have borax beeswax cream. So that is a ointment base, but the base can be also used in particular creams and formulations. Next up, you need to know the use of certain nutraceuticals and the sources like spirulina, kava, alfalfa. So you need to know the sources, and like spirulina is obtained from the BGA, blue green algae. So you need to know the sources as well of the nutraceuticals. Next up we have is antiperspirants and deodorants. So antiperspirants and deodorants basically have aluminum zirconium chloride complex. And the mechanism of action in which they work, they either neutralize the sweat or decrease the secretion of the sweat from the glands. So there are certain mechanism by which deodorants and antiperspirants work. But there is a difference between deodorants and antiperspirants. One can be applied all over the skin. Deodorant can be applied anywhere on the skin. But antiperspirant is only applied underarms. So that is a major point of differentiation between them. Next up, we have a skin problem. Sometimes questions pop up from the skin problems like blemishes, wrinkles, acne, comedogenic substances, pimples, and so many other different skin related problems. So dermatological diseases, psoriasis, again, that is one of the major diseases. So you just need to know the causes. If there is any bacteria, suppose in acne there is acne vulgaris and propionibacterium acne, so you need to know the bacteria that is involved as well. Next up, we have teeth care products. So in teeth care products, we have dentifrices, and we have other formulations like gargles, mouthwashes, and like they are used for internal use only. And teeth care products are very important because plaque, tartar, calculus is removed by desensitizing agents that reduce sensitivity, by anti-caries agent like sodium fluoride. Then you need to know the mechanism in which the fluoride acts. It will reduce the acid solubility, and then thus it will help in reducing the plaque or tartar accumulation on the teeth, on the crown of the tooth. Then we are into the BIS specification. So BIS specification is basically Bureau of Indian Standards for Cosmetics. So you have specifications like limit test for heavy metals like lead, arsenic, which is 2 ppm and 20 ppm. Then you have specification of foaming power for surfactant, how much it should be the foaming power. So all those things are very important. Hair care. Hair care products like color and conditioners. You have dyes, semi-permanent dye, temporary dye, PPD, which is paraphenylene diamine. This is a very important dye that you need to know the mechanism of action, the coupling agents, the oxidizing agents like H2O2. So we use peroxides as well in the dye. So if we divide it into phases, it will be phase 1 will be classification of the entire cosmetics, like which are tooth care, which are oral care, which are skin care, which are hair care, and which are natural, synthetic, etc. Next up, we need to know about the different types of excipients, that because excipients matter a lot. And thirdly, revising Harry's cosmetology. This is a great book, Harry's cosmetology. So you need to revise from this book as well. So that's all from today's video from Cosmeceutical and Nutraceutical. If you have any doubts, feel free to drop them in the comment section. I'll be more than happy to answer it. Thank you so much.